Seeing the increase in COVID-19 cases in India, Apollo Hospital has released new guidelines for COVID-19 treatment in the country. These guidelines are important in case you or anyone from your family is isolating at home. The guidelines are divided into three parts depending on the severity of the cases: mild, moderate, and severe illness. The symptoms for mild COVID illness include fever, cough or shortness of breath with the following symptoms like coryza, sore throat, headache, GI symptoms like abdominal pain, vomiting, and diarrhea, conjunctivitis, poor feeding and listlessness in an infant, and loss of taste or smell in older children. The oxygen concentration would be greater than 94% in room air, with respiratory rate less than 24 per minute and no signs of pneumonia. Adults ages 65 and older are at an increased risk for serious COVID-19 illness, and individuals of any age who have underlying health conditions are at a higher risk for serious COVID-19 illness. Treatment for mild illness include home isolation, symptomatic management by giving fluids, antipyretics, antitussives, and multivitamins. Stay in contact with a treating physician. Monitor temperature and oxygen saturation every 6th hour. Check blood pressure and heart rate daily. Admit to a hospital if clinical conditions worsen or fever persists for more than 7 days. Moderate COVID illness symptoms include oxygen concentration between 90 to 94% in room air, respiratory rate 20 to 30 per minute with breathlessness, low to moderate cases of pneumonia with CT scoring less than 10. The treatment involves admission in a ward and provision of oxygen support every second hour. Anti-inflammatory or immunomodulatory therapy. Give anticoagulants, adequate hydration, steroids, antibiotics according to severity of the illness. Monitor respiratory rate and oxygen concentration every second hour. Symptoms for severe COVID illness include oxygen concentration less than 90% in room air, respiratory rate greater than 30 per minute. Severe to critical cases of pneumonia found in the person with CT scoring greater than 10. In critical cases, pneumonia can progress to ARDS. Another set of symptoms are sepsis and septic shock. Treatment involves admission in ICU, provide continuous respiratory support, anti-inflammatory or immunomodulatory therapy, give anticoagulants, conservative fluids, antibiotics, steroids according to severity, provide supportive measures to manage sepsis or septic shock as per existing protocol, monitor respiratory rate and oxygen concentration continuously, prone ventilation for 16 to 18 hours per day. People with any symptoms of COVID-19 or other illness should stay at home until they are symptom-free. People who are not displaying any symptoms but have been in contact with someone who does have symptoms should also stay at home. Make sure to maintain all safety protocols including wearing a mask, maintaining social distance, and washing hands.